long, grueling years of dental school. Gross anatomy, perio, ethics, and buku of case studies. The days of memorization are over. Julian Alexander is faced with his first interview. Let's take a look.
So, Julian, tell me what you think about my facility. You know, us fellow Maharians, I just want to know what you think.
I think you guys have a great facility, but to be honest, I feel like you guys have a high volume of treatments of patients.
High volume. You know what? Maybe I didn't make it clear to you how we operate over here, but our motto is grind it out, turn and burn. That's what we do here. We are trying to get patients in and out and get money, you know?
But don't you feel like you're pressuring patients to get unnecessary treatments?
Pressuring patients? These people don't know what they need. They don't know anything. Look, we both know we're dentists. We learned all this stuff, went through all these 4 years of school and learning. We know what's best for them. You know, they're going to need that little filling down the line one day. They're probably not really brushing their teeth anyways. We know what's best. We're not hurting them, so we're helping them.
But isn't it your duty as a dentist to provide patient education?
I got all the education, okay? Alright. You see that BMW outside? I got a daughter that's in ballet. I got a son in private school. Educating patients didn't get me here. It's not gonna get you here. You're trying to be like me. You need to get on my level. And that's what we do here. So, you know, I'm gonna need you to get with the program.
Wow, Julian was just faced with a lot of ethical issues. Let's see what he's gonna do next.
Hey!
Hey guys.
Hey, Julian! How are you?
I'm fine.
How was your interview?
It was
Look
great.
at you!
Oh, thank you.
Where was it at?
Addison Smile Center.
No way.
Yeah, it was awesome.
I heard it.
Yeah, I don't know. I'm a little on the fence about it though.
Why the long face?
She has a high turnover of patients.
Listen, you know how much debt we have? You need to work somewhere where you're going to be able to pay off that debt, pay off your car, buy some food.
Wait, but what about the common good approach? Remember what we learned in ethics? You know, when you're, I think even as a dentist in your society, you're supposed to view yourself, you know, put yourself equally with the patients. You're not supposed to just, you know, turn them out and, you know, not explain things to them and just, you know, push them out.
No, but we're not equal.
Yeah, but
We've been in school for how long?
yeah, but what about memorials and stuff like that? She's even persuading patients to get unnecessary treatment.
Yes, your morals. In ethics, we learned about the virtuous approach, okay? You have to uphold your virtue and how you grew up and your morals and everything that you believe in. You can't just, you know, drop it out the door just because of an interview and a job.
No. Patients have no idea what they want. We're the specialists. We're the doctors. We're clearly smart.
Someone skipped ethics class, okay? Because she's forgetting all of that. You have to listen to yourself.
Listen, go where the money's at.
Well, I mean, Dr. Addison isn't even educating her patients. It's kind of bad. She kind of just thinks of herself that she knows what's going on.
Well, she probably has kids.
No.
She needs to take care of her family first.
I don't want to be repetitive, but this is where the rights approach comes in, okay? You can't just treat people as objects. You have to treat them and uphold their human dignity. You have to let them know and educate them, let them make the choice themselves. You can't just, you know, for the sake of money, treat patients in any way that you want.
I think you deserve a good paying job.
Well, listen to your heart, Julian.
Mia.
Hi.
Okay, so based on our case, since you're actual D4, what would you have done?
I think that I would just politely turn a job down. I would turn it down because I trust my intuition, and if usually something doesn't feel right or if something feels unethical, chances are that it is. And another reason is because you know you have to have values. You know, we as dentists and future dentists, we have a code, and you don't want to violate that code, our code of ethics. And if your values and your employer's values don't match, chances are you're going to split up. The split is inevitable. So I would just avoid the situation and just find another job.
Okay. Well, thank you so much.
You're welcome.
Okay, hi Dr. Hinel.
Hello.
Okay, so based on the facts presented in our case and the ADA Code of Conduct, how do you feel about commercial dentistry?
Well, commercial dentistry, I would say, is not all bad. The person in your case seems to either have a problem with his speed and how he can effectively get patients in and out of the office. However, if that commercial dentistry, let's say they are treatment planning people for crowns that they don't need or root canals that they don't need, then that's unethical. That goes against the ADA Code of Conduct. So basically, if they are treatment planning people for the right things and they are pushing the patients out at a faster pace, that's not necessarily unethical. That just means that those people are efficient and effective enough to do something in a reasonable amount of time.
Okay. Thank you.
Now that we've seen the ethical issues at play, we've heard the ethical approaches that should be followed. We've even heard how it's relevant in real life by listening to a D4 and the practicing dentist. Now the decision is up to Julian. What will he decide?
Hey, Shanice.
Hey, Julian.
How's it going?
Good. Did you take the job?
Oh, yeah, I did.
Why?
I mean, what's the plan?
Look at it.
300,000, 500,000, $1 million is helping money shout.
Yeah.
Yeah, and I wanted to be close to my family. Didn't want to, move.
Good reasons.
See you later, man.
It's not all about the money.
Yes, it is.
Let him take the job, okay?
Right.
She's like
So
coaching
whatever
me.
you have to do to
Okay.
tell him to take the job, don't
So-
worry about any ethical issues.
Yeah.
You're unethical right now,
You're
okay?
un-
You're unethical.
Bye.
You good. You good.
Hey, Al. Y'all need to wait till after hours.
Nah, man.
Dang.
Breon really trying to run our video.
Let's go, let's have a money shower right now.